Okay, hi everybody. Thanks for coming to another session. We have Dr. Nardos here today. I'll let her kind of introduce herself to you guys.
All right, thank you so much. My name is Rahel Nardos. I am associate professor in the division of female pelvic medicine and reconstructive surgery, also known as urogynecology, which is a subspecialty within OBGYN that is focused on providing medical and surgical care for women with pelvic floor disorders such as incontinence, prolapse, pelvic bladder pain, those kind of issues. So I've been at the University of Minnesota for the last year. Before that, I was actually practicing out of Portland, Oregon for the previous 12 years or so. I did my fellowship at Oregon Health and Science University and kind of stayed on as a joint faculty between Kaiser Permanente and OHSU for the previous 9 years or so. I'm also director of Global Women's Health at the Center for Global Health and Social Responsibility here at the university. So I do a lot of international work that is related to women. So a lot of education of other doctors and surgeons in low resource settings, research. Yeah, so I'm happy to answer any questions.
Yeah, the first one we always kind of ask is like why you kind of chose that specialty, and you said you even specialized even more into like pelvic area. So like what kind of interested you in OBGYN and to specialize in like the specific area?
Yeah, good question. I mean, I grew up in Ethiopia and I've been a patient many times. And there's one of the things you learn growing up in low resource setting like that is some of the inequities in healthcare, and particularly there's widespread inequities for everyone, but in general, women always end up carrying the highest burden because of, ingrained inequities, gender inequities that are socially, culturally, politically kind of built in. And, women are the only ones who carry the burden of childbirth and pregnancy. And when you have poor healthcare systems, it puts them at a very high risk. And so I think growing up, I was pretty aware of that and figuring out ways that I can help in some small way address those issues. So, even though I can't tell you there was a specific moment in my life when I felt like I need to go to OBGYN, I actually considered different professions within healthcare in which I could serve women. So I wasn't 100% sure I wanted to go into medicine. So I took a couple of years off to kind of assess what I want to do, did some research. But ultimately it came down to, I really want to take care of women and also apply my passion for global health in some way to improve clinical care for women. And so I decided to apply for med school. And honestly, I think I almost came to OBGYN by way of really understanding myself. So even though I knew I wanted to do something in women's health, you can go and do a women's health care through primary care, through family medicine, through internal medicine, surgery. Pretty much every profession you go, you can take care of women. But I kind of wanted to, number one, focus entirely on women and not women and men. And so that was a big part of why I chose OBGYN. I also realized I liked both the combination of longer term relationship with patients along their life cycle, but also surgery. I enjoy doing things with my hands and seeing some of the immediate impact you can make through surgery. And so that kind of narrows down some of the options within women's health field. So by like through that is how I ended up in OBGYN. And then when I did my OBGYN residency training, I again, thinking about myself and my own personality and my priorities, I realized that I was more gravitating towards quality of life for women and more of a surgical environment. And I also realized that I'm not the type of person who is an adrenaline junkie. I don't like too much excitement. It's just not my personality. And there's a lot of excitement in OB because, you have to be, ready to act very quickly for complications. And, I find that that part is not really, resonating with that, with my own personality. And also you have to be willing to work day shift and night shift, alternating, and you have to be that kind of person who kind of enjoys doing that. I considered doing GYN oncology for a while because it's very surgical as well, which I love the surgery aspect, but I realized again, I am the type of person who really it's hard, I get very, very connected with the patients, and it's really hard for me sometimes to deal with complications and problems such as, some of the poor outcomes that happen in cancer care. Even though it's so rewarding as a profession, it also comes with, with a lot of losses as well. And so, honestly, it's kind of a self-discovery along the way for me. Like, where is the area where I feel more like myself, that I'm not fighting, and that I can really express my full potential? And I think urogynecology, everything kind of pointed towards urogyn. It's quality of life. You get to follow these patients longer term. They're wonderful people. I love our population of women. And it's quality of life. So you can really dictate your care well without feeling anything is urgent, or, that you have to make quick decisions. You can really get the time to work with your patients in surgery planning, or who's a good candidate, and some of the other behavioral interventions and medical interventions we can do. So for me, that was kind of a really good fit with the goal of it, but also my own personality and my skills. But also, there's a lot of women globally who suffer from childbirth injuries, and it tends to be neglected because everyone is definitely focused on maternal health or child health in the sense of saving the mother's life, which is really, really important. But when it comes to all the other problems that arise as a result of childbirth with the pelvic floor injuries like fistula, incontinence, prolapse, there isn't as much focus on that. And so it's a very vulnerable community. And so it was a good fit for me to pursue my interest in global health as well, to make a difference in that population.
In the comments, Jennifer was wondering what has been the most challenging part of your career and what parts are most rewarding.
I would say something is echoing. I don't know if it's me or, oh, that's better now. Challenging part, residency is hard. You guys are all medical students, right? Or no?
They're all pre-health, so either like pre-med or
Pre-health.
pre-PA. And
Yeah. I would say residency training, I wouldn't lie to you, is really, really hard. And I actually had my first baby, my son, when I was a second year OBGYN resident. And that was a really hard time, to juggle taking care of my baby and working more than 80 hours a week, which at that time they didn't actually have the 80-hour rule. So it was basically a lot more than that. And I think you have to have a lot of stamina and resilience to go through medical training, which is why it's really important to know exactly why you're doing it and if this is the right thing to do for you. Because I think those are the things, when you're really clear on why you're doing it, are the things that is going to sustain you during the training program, which would require a lot of hard work and commitment. And also challenge, because obviously you're dealing with patients, you will experience some losses, you will have a lot of challenges, but at the same time the learning is also really, really exciting, and it's such a privilege to be in healthcare field. So being able to see the privileges and understanding the challenges, all of those things, you need to have a very clear sense of this is what I want to do, and I know it's going to be hard, but I can do it kind of mentality. So I say my biggest challenge was residency. And then I think as time goes on, I think every healthcare provider gets challenged with meeting all the requirements of healthcare, in terms of how many patients you have to see and all the paperwork you have to complete, documentation, all of those things sometimes can be overwhelming. And then balancing that with your home life, if you have family, have 2 kids. And so kind of making sure that I'm here for them when they need me and I'm available to take part in some of their activities, but at the same time balancing it with the requirement of healthcare. Those are always challenging, but I think those are challenging no matter what field you choose. I think healthcare definitely has a little bit more of a psychological burden just because you are in charge of people's lives. Basically, your decision makes a big difference in people's lives, whether they live or die, or whether their quality of life is improved or not. So, I think that adds a layer of stressors as well. But honestly, I think, to be honest with you, the biggest challenge for most healthcare providers, including myself, is not so much the work itself, in the sense that you get really well trained to do the work. They don't just let you go and do surgery on people without really training you. So that's the real reason why you have to go through 4 years of med school, and 4, 5, 6 years of residency, and then even more years of fellowship. Like I did 3 years of fellowship after 4 years of residency. By the time you're done, you actually feel like you have the skills. I think that the most challenging part is the human part. We always say that is how you work with other people, how you interact with patients, the soft skills that you don't always have a lot of education on. A lot of it is you bring your own personality and your own insights into it, but you learn on the job. And I think the hardest part is always the people's part, because it's not a practice of isolation. Healthcare, unless you're a pathologist or a radiologist, a lot of the fields in medicine require you to really know how to work with people, honestly, and collaborate with other people. And it's a team sport. And to be interacting with patients and to be clear with your communication skills and all of that. And so if you don't have those skills, things can be challenging. And when you do have those skills, things get a lot easier. So I would say those are kind of the challenges. I do a lot of international work, like I said, and I think early on when I was trying to build my career in global health, that was also challenging, in the sense that there aren't many institutions, academic especially institutions, that support global health work. So a lot of that you have to kind of build into your career. It requires a lot of heavy lifting on your part. It's not like you can just fit into a system and just be accepted and given time to do those things. You kind of have to create the time. You have to do a lot of your own volunteer time and stuff. So, that is challenging, but that's also very, very rewarding work. So I think the things that are rewarding to me are the privilege of caring for patients and being trusted by them to operate on them and to do things, to have that trust is really humbling. I'm always amazed by how that happens. How does this patient meet me once or twice for the first time in their life and then trust me with their life? Like basically to take them to the operating room, put them to sleep and operate on them, how does that happen? And I don't want to forget the privilege of that. I think when we start forgetting is when we start not being fulfilled with our work. So that's very rewarding for me. I love doing research if the research really informs my care of patients. So I get really excited about that. The idea of coming up with solutions at the same time as I'm caring for patients. If I have a question, if something is not working, I like to be able to be part of the solution and not just complain about it. So part of my career has been integrating research into my clinical work. I did do a master's in clinical research as part of my fellowship, so I feel comfortable doing research. But I also love doing interprofessional research projects. So a lot of my work has been in collaboration with people in other disciplines who bring a whole different mindset to the problems that I'm facing in my field. And that also is rewarding in that you're always learning from other people who think very differently from you. And so, for me, the research part has been very rewarding. And then the global health work, obviously, my passion growing up in Ethiopia and seeing a lot of health inequities. How can we how can we help in small ways to help solve that problem? So a lot of the work I do is educating healthcare providers in those countries to become better and to improve their skills in patient care, to improve the quality of care that women get. And that's really, it's very rewarding when you do that, because they don't, your work goes a long way when it's impacting in a setting where things are not as well resourced. So it really is a very fulfilling thing to teach somebody how to do things in a place where maybe they don't have as many teachers with your kind of expertise, so your impact goes much higher, because then you're creating local capacity where the women in that local community now have experts who can help them when they didn't have it before. Those kind of educational collaborations will go way more further than you feel the impact you're making here in some ways, because there's definitely a lot more resources here for learners, a lot more educators here. So for me, that balance between the local and global has been a source of fulfillment, I would say, and very rewarding.
You mentioned earlier about your international work, and also on your U of M bio, it says that you're the director of global women's health for the Center of Health and Social Responsibility. Could you talk a little bit more about what specifically the kind of work you do and the traveling it kind of entails?
Well, not much traveling the last year and a half for obvious reasons. So I'm kind of like you guys, converting to virtual media. We've been kind of basically not have been able to travel anywhere. The last time I have done any international work on the ground was to train our urogynecology fellows in Ethiopia, and that was in February of 2020. I was also in Botswana at the same time because we were starting a urogyn faculty development program there. And I was working with the faculty in their OBGYN department at the University of Botswana. And I haven't been able to go back either places for over a year now because of the pandemic, and they're dealing with a lot more now. So I I have to say, I've only been here for a little over a year. And so I haven't been able to do those, kind of partnership building and on the ground work, but it's given me the opportunity to create communities here with the global health community. There's a rich global health community here at the university in different departments. So we meet every month. We started meeting every month to talk about global health and our educational missions. And it's been a wonderful community. So that I know when I start traveling and doing work, I know who to call for what help with what partners, So that's kind of, I'm networking at this point to make sure that I have all the people and resources necessary to build capacity with our partners when the time is right. We also have built a women's health empowerment and leadership group that is made up of multiple centers across the university and outside who do women's based work either from policy perspective or human rights perspective or bioethics or environmental health. And we've been meeting also regularly to work on joint webinars that bring in all of those topics into women's health area. And it's been a wonderful to network with that community because again, when we are ready to do bigger projects that require the collective wisdom of all of those people, we are creating the communities right here that would then help us do bigger things abroad, right? So my focus has been in the last year on that, on building those communities, and then starting to create opportunities for collaboration. And once the pandemic is a little better, once our partners have better access to vaccines, so they're safer, we will start working on the ground, on a lot of our educational missions, research partnerships, and community outreach work. So, the other thing with global health is it's not just international, right? It's global health is also local health. So we're working on getting to know our communities here that are underserved and how we can support them. And so some of my early kind of focus in the last several months that I've been here has been partnering with community organizations to start understanding what the barriers to women's healthcare is, and then figuring out ways that we can start alleviating some of that barriers. So that's that's kind of where I am. By the way, I mean, we do have through the Center for Global Health and Social Responsibility, a lot of educational programming for students. So you guys should definitely check out their website from time to time. We have case competitions we do every year on global health that students participate in. I'm not sure if pre-medical students are part of that, but the sessions themselves when the competitions happen are open for everybody. We do a lot of webinars and lecture series on global health equity stuff. So there's definitely a lot of resources in the university on these topics if there's anybody who is interested in learning more. Any other questions? What are your tips for studying in medical school? Oh my gosh, I'm like totally detached from med school. Med school was, when did I go to med school? 99 to 2003. I'm not sure if my techniques are relevant anymore, but I remember we used to do a lot of group studying with some of my friends. I remember making lots of cards with information and just having group like study sessions where we ask each other questions. And I am one of those people who likes to work on my own a lot. I do better when I'm not distracted. So those group things I do them, but I do them in a very limited way. I do better when I just focus and study on my own. So I spent a lot of time in the Yale Law School library because that was a quiet place where I didn't see too many of my own classmates. That's the other thing. I think for me, it stresses me out when I see my own classmates studying and like asking questions all the time and worrying about an exam. So I tend to like to study in coffee shops and other school libraries where I don't see too many medical students. But that's just my style, I so that's kind of what I did. But I also went to Yale, and at that time, Yale did not have shelf exams, believe it or not. They changed now, but I loved that they weren't so focused on testing us all the time. And the exams they give us, they were pass or fail, and they didn't happen every week or every 2 weeks. So we actually didn't get tested that often. And what's great about that is almost everyone in my class, like a lot of my classmates, they all had other activities outside of medical school. We all, I mean, I was involved in 3 or 4, projects in the community with, homeless shelters and all of that. And in retrospect, I'm thinking, how did I do all that during med school? And it's because I wasn't always studying for a test, that was so a lot of the Yale philosophy of education was self-learning. And we would be asked for example, when we rotated on the floors, when we finally started our clinical rotations, we'll be asked to present on a particular case or a patient or something, and we will do research on that and make sure we know everything about it. But that was a really nice way of learning something, because you already have a patient, so you knew the story and everything, as opposed to just book studying all the time. So personally, I really benefited and flourished from that system. And that's not the reality in almost, I heard after I left Yale that even they started doing some shelf exams. So I think everyone now tests all the time, which I'm not a big fan of testing. It doesn't always work for everybody. I also loved that it was pass or fail, because then the scores weren't the stressor for me all the time. So basically, I was being trained to really provide patient-centered care and to really develop the skills of self-learning without constant monitoring, which is kind of what the real life situations are. I will tell you, even though you have to memorize a whole bunch of stuff in medical school, when you actually practice in the real world, you can look up everything at the tip of your fingers. You have a phone, you can look up anything, So like all this detailed information about the cycle of chemicals and this and that, and the name of this muscle and that muscle, you can easily look it up, right? So in the real world, when you have to know those things to pass your tests in medical school. But I always tell students, in the long run, you don't have to remember all of these facts. You just have to know where to look for them. And what you do want to learn is how to listen to patients, how to pay attention to symptoms, how to become a good diagnostician, good communicator, and then how to synthesize information, learn how to find the right information from where, and to think logically and all of those things. Those things you need to develop those skills. And how to recognize when a patient is really sick or acute, and when you have to act fast and when you don't, and all of those things. But when it comes to facts and details, you will need to study it just to pass your test. But I hope you don't share this with other people. Teachers are going to be very mad at me. But I will tell you, in the real life, a lot of it, we've come to the stage now where all of that information is available online or in your phone or on an app. You don't even have to carry this big booklets in your pocket, which I used to do when I was a resident, right? Because it was not easy to find the information anywhere else. But now you have all of that very easily available. So that might take some of the pressure off when you're studying. I don't know if I answered your questions for studying in a medical school. Okay. I would totally ask people who are closer to being done with med school on that question though. Like when you start doing your clinical rotations, if you're able to, that would be good to get from the residents and, you know, those people who are much closer to this medical education.
Yeah, and then kind of like a closing question we kind of asked all the physicians was, what was kind of your most memorable patient, whether it was like a bad experience or a situation that went really well, something that just kind of stuck with you throughout your experiences?
Well, I have a lot of those in the international settings. But I would say, I mean, for your purposes of making it more relevant to the US setting, when I first became, finished my fellowship training and I started practicing, in my first year, I had, probably one of my most severe complications. I haven't had anything like that since. It turns out that my most severe complication happened in my first year, and then I haven't had anything much happen since then. But I think those things are more likely to happen when you're a little bit less experienced. Anyway, we do this long laparoscopic procedures for pelvic reconstruction, and we were doing one of those, and the patient started bleeding from a small tear in her, like microscopic, there's this microscopic artery that goes along the tailbone area where we operate on to put stitches in. You cannot see it very well, but it's there and we all know about it. And she started bleeding out of that site and we couldn't get it to stop. I mean, I was operating with one of my more senior faculty. She was assisting me. We couldn't get it to stop. So we had to convert to an open. And it was that area is a very hard area to find the bleeder. If you start bleeding there, there's like, we always heard about it during training. It's like the worst thing that can happen with this procedure. And so, and not too many good options to stop it. So we opened, we put a lot of pressure. Obviously you can tell, like I was just sweating, and you have to really be almost like an opera conductor. When something like that happens, everybody has to kind of work in tandem, making sure there's blood available. And we were, she was, we had to put pressure on the area, but the minute we lift the pressure up to see where the bleeding is, she'll start bleeding a lot. So then we had to put pressure back again, and we had to get the anesthesiologist to give all the blood products and wait for that to happen until like we try again to see if we can find it, and trying different things to stop it. It turned out it took like about 8 hours to finally get it to stop. And I operate on older patients because that's kind of my field. So you don't have too much reserve on these patients. But we were really able to work as a team to make sure she was getting all the resuscitation things she needs so that she doesn't get too sick. And we finally got it to stop. And we finished the procedure, and the patient ended up having some nerve problems from this because it was in the sacral area, so the nerves that go down to her leg, one of her legs, was impacted while we were trying to get the bleeder to stop. We had to do multiple different attempts with ligation and all those kind of things. So then I had to send her to physical therapy and neurologic treatment for basically this poor patient went through 1 year of recovery from this chronically. But what was really amazing was she brought me presents when she came to see me. So this is actually one of the things that's always amazing to me. I've had other complications, not this bad, but patients who actually, if you're really honest with them about what happened and you do your best to take care of them and to be present for them, they actually appreciate it. I feel like sometimes more than patients who do well, because a lot of the presence I get from patients is from patients who don't have the most streamlined recovery sometimes. They come back and they give you things to say thank you for being there. So that was a real memorable thing for me, that this patient who's had all this thing happen to her is like, so grateful and thankful. So I think, again, this is one of those reasons why healthcare is so fulfilling as well. You build relationships even when you think you're having your worst experience. It's a big lesson. Any other last questions? No, we have 2 more minutes. And I wish you all good luck. And I hope you get to actually do things in person soon. Do you not? So